Welcome to We Are Old, Get Over It, the podcast where we celebrate the wisdom of age and maybe a little grumbling too. Our guests dive into topics that matter most to us, from navigating the digital world to embracing new adventures and the challenges that hold us back. Join me for about 30 minutes of insightful conversations, honest reflections, and a whole lot of get over it attitude. So let's get started.
Everybody is from New York.
That's right. Okay. Hello, everyone. As usual, we were continuing a conversation before we hooked you guys in for today's podcast. Today's podcast is about sex for seniors. And it could be a very sensitive subject, so sensitive that I had to get a doctor to explain it to us. So I've invited a physician from San Jose, is that correct? California?
Correct, San Jose,
okay.
California.
Dr. Robert Panvini, who is recently retired. We had a long conversation before this podcast ever spoke, and he's a very interesting man. And we took him away from his golf game to give you some advice today. So we're going to talk about the taboos of sex as you get older. By acknowledging that there's social discomfort around discussing senior sexuality. It's like your kids saying, oh my God, I can't imagine my parents having sex. Imagine if my grandparents are having sex. So I'm going to introduce the doctor, let him speak. And first, I'd like to ask you to explain what a urologist does.
All right. Well, first of all, thank you for having me on your podcast. I've been looking forward to it. I think it's really a great forum. And I think the subject that we're going to talk about today is really appropriate and so needed for seniors to hear about, because it's things that is suppressed a lot. It's not discussed. It's taboo, and it needs to be out in the open, basically. So I started my career in urology over 40 years ago. My father was a physician, and so I guess subliminally it was instilled in me that that's probably a good career choice. And so I went on that path. And as anyone basically in medical school finds out, is they now, they know they're going to be a doctor, but what kind of doctor am I going to be? So that was the choice that I faced in medical school. What do I want to do the rest of my life? Do I want to be a surgeon? Do I want to be an internist, a cardiologist, urologist? And so you basically rotate through all these different disciplines during your clinical years in medical school, and you get a taste of it. And basically you match your personality to the personalities of people that migrate toward those fields, basically. So a urologist, it's a surgical field, but it is a combination. There is some medicine in it. Medicine's broken down into surgical fields and non-surgical or medical fields, such as internal medicine and all the different subspecialties. So surgeons generally have a need for immediate gratification, and that's basically what draws most people into surgical fields. They don't want to really treat chronic diseases. So urology is a surgical subspecialty, but it's different than general surgery in that the people that go into it generally are a little bit more, would you say, jovial, playful, have a good sense of humor. They are very extroverted, a lot of them. They're very interactive. But it's a field that covers a lot of territory. There's a lot of dynamics to it, in that we're taking care of people that have anything from cancers to sexual dysfunction, to congenital abnormalities of the genital urinary tract, to kidney stones, urinary problems, prostate problems, We do pediatric urology as well. There's a whole certain set of problems that go along in the pediatric age group that we take care of. So it is pretty dynamic, and it's a question I get asked all the time. Why urology? Why did you go into urology, basically? And you generally have to really be involved in medicine to really appreciate the nuances between all the different fields. But it just fit my personality the best, and I've enjoyed uh, taking care of patients. When I was young, my father had a big general practice, and he had 50 patients a day he saw, and I knew I didn't want to do that. I wanted at that time thought I wanted to do surgery and kind of be a hero and cure someone of cancer, and that was it. But as I got older, I find that I enjoy more not doing the surgery and having someone as a patient, fixing them and sending them off, but having those patients that come see me over and over again through the years that I've developed relationships with. And so you get both worlds with urology.
Okay. So, but urologists basically are below the belt physicians, correct?
Well, for the most part, the kidneys tend, unless you wear your pants up by your chest, the kidneys do lie above the belt, but it's basically genital urinary problems. So
Got it.
things that affect your urinary tract, which involve your kidneys, your ureters, your bladder, and your genitals, basically. There is an overlap a little bit with gynecologists in that they do treat, female genital problems. And so you might have a gynecologist treating some of the same things that we treat, such as urinary incontinence in women. That's a big thing. And so gynecologists treat that and they do surgeries for that, just as a urologist treats it medically as well as surgically. So there is some overlap in the field.
Let me ask you a question. Uh, Physiological shifts because of age, hormonal changes and things like that, menopause, whatever men go through, hot flashes. How does this affect the libido and the functioning of our sexual organs?
Well, it is the most important factor in terms of your libido is your hormonal regulation of that. That's what drives your libido, and that's what sex drive is. It is regulated by hormones. And so if you take away the hormones from someone, their sex drive goes in the toilet. And so a natural occurrence with aging is that there's a decline in the production of your sex hormones. In the case of a man, that's testosterone. In the case of a woman, that's estrogen and various female hormones. Now, the difference is that in the female spectrum, it happens quite abruptly. When women go through menopause, there's a rapid drop off of the production of estrogen by their ovary. And physiologically, their body reacts to that quite severely. So that's what people tend to cause the, menopause, female menopause, which can be very dramatic in terms of their mood, in terms of their physiological response, hot flashes, and racing heartbeat, and it's very acute. And as such, they tend to seek medical attention when it happens, and they tend to be then treated for it by hormone replacement.
Mhm.
That does a wonderful job quieting down all these symptoms they have and also can restore the sex drive. Now, unfortunately, female hormone replacement has gotten a bad rap because of the perceived association with breast cancer from female hormone replacement, which there are many articles on that, but the the bottom line is it's not really um, it's overstated. And because of that, there had been a tendency to not keep women on female hormone replacement, to use it as a treatment for menopause, but then wean them off of the female hormone replacement once they've stabilized. So it has helped in terms of their symptoms, but it hasn't helped in the long term in terms of their sex drive and libido. And that tends to be low in women that are postmenopausal if they're not on female hormone replacement. I'm not saying every woman, but it does certainly less and diminish. With men, it's a lot different. The male, what we call climacteric, which is the change in the decrease in the hormone production, is more subtle. It occurs slowly. And because of this, it's not recognized many times. And I would say most of the time it's not recognized because they don't have the acute symptoms that women have. It's just a very slow, insidious decline in various functions, not just the sex drive, but in terms of their strength, their mental acuity, their ability physiologically to respond as a younger person would. So many men never get treated for that. When you go to a doctor and you say, I want to have my routine physical and check me for, what doctors generally do on annual physicals, they have a whole panel of blood work that's done, including a metabolic panel that looks at your liver functions, your kidney functions, your electrolytes, your calcium level. Then they get your lipids to look at your cholesterol, your fats. They get a complete blood count, looks at your production of red cells and white cells that are necessary for your immune system for defending against infections. They may throw in a thyroid panel. They may look at vitamin D, but something that's left out many times is the hormone level, the testosterone level. What is it? Because we're not complaining of that. We don't go into the doctor and complain of that. So the women did because they're getting these terrible hot flashes and, it's miserable. So it gets ignored a lot of time with men. They just attribute to the decline in desire, in sexual function, in your strength and overall conditioning to aging. And it doesn't have to be that way because with male hormone replacement, all those things will improve and get better. I'm not saying you're going to be 20 years old again, but
Mm.
you certainly will have more energy. You'll have better libido. You'll have better sexual function. So it is something that every male after 50 or 60 certainly should have their hormones checked and have their testosterone checked and see if they're on the low side.
The testosterone is it? Do you get it through an injection?
There's various ways of giving testosterone replacement therapy, what we call TRT. And this
Really?
has become a big, big business. There are now wellness clinics and all sorts of clinics that are, advertising online in terms of um, overall wellness. And one component of that is TRT for men and testosterone replacement. It can be given various ways. Traditionally or typically, a lot of medicines are given by a pill or oral, medication. That doesn't work very well with testosterone for two reasons. Number one is that when you take the pill, it's metabolized and in your liver, and as it goes through your liver, it inactivates the compound completely. So it makes the testosterone useless, basically.
Right.
The second thing is, as it's metabolized by the liver, it is very damaging to the liver. It can cause what we call hepatotoxicity or liver damage.
Hmm.
So typically, oral testosterone replacement is not part of TRT. There are some newer preparations that have just come out that are pills that are starting to be used. But for the most part, it's given either by a topical, which is a cream that you would rub on, or by what's called the parental route, which is injection, basically. Uh, I've used in my practice for most of the time parenteral injections, and I've taught my patients self administration with subcutaneous injections once a week of the testosterone.
Where do
It's
you do
easy to
the
do. It's kind of like a diabetic
where do you
giving
do
themselves
the
insulin.
where do you do the injection?
You could do it any part of your body that has some fat. Typically, most people give it in the abdomen,
Okay.
just like people would give an insulin injection there. But you can give it anywhere in your body. You can also give it by intramuscular route, where it's a deeper injection into the muscle with a little larger needle. That's more difficult for a patient to self-administer, to jab a needle all the way into their muscle. Not everyone's able to do that, but I find that almost everybody, even people with phobias about needles, can give themselves this self injection in the fat. They even make it so it comes in a cartridge, just like epinephrine. You don't
Hmm.
have the needle you see anything. It's just something you press and it automatically injects.
So if a gentleman walks into your office and says, "Doc, I'm having a real hard time right now, getting hard," and you suggest this to them, and you have really good medical coverage, is it covered through your medical coverage, through your medical plans?
Yes, generally the testosterone blood test will be covered. Uh, all insurance plans are different. So many plans will cover testosterone replacement therapy of some sort. Uh, but even if it's not covered, the cost of it is very inexpensive. I mean, it could be a couple of dollars a shot, basically.
Really?
So most people can afford that out of their own pocket. So cost generally is not an issue.
Hmm. That's interesting because I never even knew that.
Hmm. Yeah,
And
there are clinics that will, you know, they will have a bias and tend to persuade people to use a certain thing that they have to administer, in which it is a revenue generating
of course.
business for them, such as pellet therapy. So, with testosterone pellet therapy, you get a small implant of a pellet that is testosterone that's put under your skin in the fat, and it's administered once every 4 months or 3 months or 6 months, depending on the preparation. You have to go into the clinic, and it's a small little procedure to get this larger size needle, or what we call a trocar, put under the skin and deposit the pellets. And that costs a lot more money. And as I say, it can be a revenue generating um, practice for a lot of these
So,
clinics.
would you have to go to a urologist for this prescription, let's say that you were going to give yourself a needle, or would you just go to when you go for your annual physical with your internist? Would they do that? Or should you see a specialist?
Well, some internists will do it. Some internists will prescribe testosterone, but the majority of them won't. I mean, I think the
Interesting.
majority will refer a patient on to the urologist and the specialist or even sometimes an endocrinologist. So an
Okay.
endocrinologist is a hormone doctor, a
Yes.
glandular doctor. They treat all different uh, disabilities or illnesses that have to do with various glands in the body. And this is a glandular problem. Low testosterone is produced by a gland. And so endocrinologists as well will treat that. But there are many clinics out there. If go online and you look at wellness clinics or testosterone replacement clinics, They're all over the place. And you'll find that a lot of them don't have urologists or endocrinologists.
Hmm.
They just have a medical doctor that actually was, looking for a business in which they can um, have a lot of these clinics don't accept insurance. So have a cash business that will give a good, cash flow, and they have a medical license, and they're able to prescribe these medications as any physician is. So they make that their specialty, their
Hmm.
self-proclaimed specialty.
So, for example, the things that seem to be most popular that most men and women know about are the pills, the Viagra's, uh, those kind of pills.
Mhm.
Why have those become so popular versus what you're speaking about here, the TRT?
Right. Well, there's a difference between sexual dysfunction encompasses a lot of different components. Okay.
Okay.
So, sexual dysfunction is that you're not functioning properly from a sexual standpoint. So, that could be a problem from arousal or desire,
Hmm.
or it can be a problem in terms of performance, and erectile dysfunction.
Hmm.
And these two things are very different. So, arousal desire problems, or what we call the libido, as I said before, are controlled by your hormones, by testosterone.
Right.
And the performance end of it, the erections, many men as they get older, they're not getting good firm erections anymore. They may not even get erections firm enough for penetration. And that's a whole different host of problems aside from the hormone problem. Most of the time, it is vascular. As men get older, there's not as good blood flow in there. The small blood vessels and that carry blood to the penis generally are not functioning well. They're not carrying as much blood for many reasons. The most common is some buildup of atherosclerosis, which restricts the flow of blood into the penis, basically.
Hmm.
So Viagra and the PD5 inhibitors, what we call them, that class of medication, will enhance the blood flow to the penis. It's
Hmm.
a whole mechanism that is controlled chemically with nitrous oxide, increase in the release of that, which dilates those blood vessels and allows more blood to then provide a better erection.
So it's a combination of the TR. It could be a combination of the TRT and ED, correct?
Correct. But
Okay.
if a person has true ED, okay, they've got some issues with blood flow or the
Hmm.
smooth muscle response in the penis that's not allowing for good erections. Giving testosterone itself is not going to correct that. Okay, that's something that's poorly understood.
Hmm.
Many people think that if you take Viagra, it's going to correct your sexual dysfunction,
Hmm.
where maybe a large part of your sexual dysfunction is because of low hormone and poor desire, or just psychological reasons for poor libido or poor desire. So the Viagra is not going to basically enhance or make their sexual dysfunction better.
I
On the
see.
other hand, also, people that take testosterone may often think, well, that's going to, fix my erectile dysfunction. And while it may improve their desire, it may not fix their erectile dysfunction. So many times you have to evaluate where the problem lies, if it's one or the other, but commonly it's both. There's an
Hmm.
overlap.
Right.
There's these graphics of desire, function,
Hmm.
and these circles, and it overlaps, and you may have to treat both. But in some people, it's only one or the other,
Hmm.
and so as a urologist, a specialist, our job is to find out what the problem actually is, and then the appropriate treatment. If this person just needs a pill or medication, or this person needs hormone replacement, or they need both.
Okay, let's go to the other sex for a second.
All
Uh,
right, my
let's
favorite sex.
okay. Let's talk about the issues that women have as they age,
Mhm.
about the desire, number one, about dryness, number two. Do they need they need lubrication? Explain that whole physiology of the women's side of this.
Right. So, yeah, on the women's side, it can be quite different. They do have still the hormone regulation, the control. It's not so much an issue in terms of with men, such as function with getting, a rigid penis and their
Mhm.
problems with blood flow, but they have other issues with their genitals, such as dryness. When women stop producing estrogen as they have when they're young, that does have effects on their genitals. And it will certainly decrease the lubrication. Women that have hormones, or women premenopausal, their hormones are allowing a natural secretion of lubricants from the vagina that make it comfortable to have intercourse.
Mhm.
Not only in postmenopausal women, they're not producing the fluid that makes it comfortable, but the lack of estrogen on the vaginal tissue itself makes the vaginal membrane, these are what's called mucosal membranes, it makes them thin, it makes them dry, and it makes it subject to little micro abrasions or tears that can be quite painful or
Mm,
uncomfortable.
I
So if they
see.
don't have the lubrication, if they don't have the natural vaginal thickness, it's going to be very uncomfortable for women. And so that's another reason that women can tend to shy away from sex, because it's not only is it no longer pleasurable, it's uncomfortable for them.
Mhm.
And so there again, replacement of hormones can really help, and you can do that. You don't have to take systemic hormones, vaginal hormones, especially the ones that they worry about may increase the risk of breast cancer, are typically pills or these implants. But you can use topical or a cream,
Mhm.
vaginal estrogen replacement, of applying just a little bit of cream on the vaginal tissues every other night or a couple of nights a week. And that will be enough really to increase the thickness, the moisture and everything with the women's vagina that really has become deconditioned, basically.
Interesting. So, and I know that you can just go to a pharmacy and buy something off the shelf, correct? And I guess
Well, you're
I
not
did a
getting
little
a
research.
hormone preparation off the shelf. What you
No,
can
no, no.
buy
I
at the
mean, I'm talking
pharmacy
about
is
lubricants.
vaginal lubricants
Right.
or genital lubricants,
Hmm.
Astroglide. There's a whole host of different ones that can be aqueous or oil based, that will provide lubrication that makes it more comfortable, but
So
it
now
will
you're
not improve the vaginal health. It won't increase the thickness and the natural moisture of the vaginal tissues. For
okay.
that, it's a hormone preparation. You do need to get a prescription from a physician for a hormone cream or a hormone replacement.
So women probably initially would try to just buy something, what I would say is off the shelf. And then if that doesn't seem to work for them, then they would go to their physician and get a hormonal cream, is what you're saying, correct?
Correct. And I don't see as many women for this problem as I do men.
Hmm.
People think of a urologist as being more of a man's type of physician,
Hmm.
although we do treat women for various things, incontinence and urinary infections, kidney stones. But primarily, women have a relationship with their gynecologist. I mean, it may be the same person that delivered their children
I
years
understand.
before, obstetrician, gynecologist. And so a lot of women use their gynecologist as their primary care doctor. But this is a conversation that is much more common between a woman and her gynecologist. And the gynecologist will, prescribe or recommend things. Now, again, some gynecologists uh, will focus more on hormone replacement. And there's not just one hormone for women the way there is for men, testosterone, but there's progesterone, there's estrogen, there are other hormones, and many times it's a combination of these hormones. And as a matter of fact, women have typically produced a low level of testosterone also, just as men produce a very low level of estrogen.
Of course.
But the testosterone in women is really what accounts for their libido. And so
Hmm.
when they're not producing
Really?
hormones and they're not producing any of that low level of testosterone, their libido goes down. And the doctors that really know how to treat women for estrogen replacement, and especially when the issue is sexual function and libido, will give a combination of estrogen replacements which include a very low level of testosterone. That will really spark or enhance a woman's sex drive.
Interesting. Well, let's
She's
talk
not
about
going to grow a mustache, okay?
what's that? They're not going to grow a mustache.
by
Uh,
by taking a low
I have
level of
something I could say, but I'm
testosterone.
not going to say that. And I'm not going to respond to your question. Okay, let's talk about emotional intimacy a little bit. As you get older, uh, people are, I think, sensitive about that.
Mhm.
Who do they talk to besides each other?
Well,
Like if they're if someone's trying to have sex and the man can't get hard,
right.
uh, and the woman wants to have sex, but she's frustrated, or the man wants to have sex and he's frustrated. Who should they be talking to besides each
Yeah,
other?
that's really an excellent question because so far we've talked really just about physiological things,
Yes,
hormones and blood flow, erectile dysfunction.
right.
The other major component of sexual function is psychological
Mhm.
and emotional. And that's an area where, unless you have a physician that has plenty of time to spend with his patients,
I've never
or
met one of those physicians.
well, that we're basically got to get our RVUs, which is our billing units up, and
Right,
so
I
we have to
understand.
keep going with high volume. But it is something that does many times require long conversations, which your family doctor, your internist, your urologist, and all that really don't have the time in their schedule. We're not paid by the time frame the way you would see a therapist, a psychologist, or someone like that. So there are psychologists with special interests and special training in sexual dysfunction, and they're excellent at what they do because they're taking a subject which is sensitive and difficult to talk about and making it easy for these people to come in and talk about it. And you can't do that in 5 minutes or 10 minutes in an office visit, basically. It is therapy, and it's something that's very valuable. Now, a man and a woman, I mean, like you said, can take it on themselves and try to talk about it themselves. But most of the time, they need help, basically, because there are things that they don't understand also about their bodies. and about their minds. So they can find resources themselves short of, of going to a therapist, a sex therapist.
Mhm.
There are seminars out there, there are podcasts, there are all sorts of things that they can look to and get a lot of information that can help them on their own personal conversation with this. But there are psychologists that really do an excellent job. And when I have a patient that we begin this conversation, and I could see that there is a big psychological component or emotional component to their sexual dysfunction. It's not just their hormones, it's not just their erectile dysfunction. They need to talk to someone. I have psychologists that basically I refer them to and tell them, listen, many people don't want to go and see a psychologist. It may not be covered by their insurance. It's time consuming, but it's very, very valuable. And I think that conversation and discussion does take time, and it is something that men and women have to have, either between themselves or with the help of someone else.
Great. Okay. I'm going to run through some at the very end of this. I think I spoke to you about it. I'm going to mention some websites and organizations that people can reach out to. But you and I don't have to talk about this now. Is there any final thoughts you have about advice for our seniors out there that are really
Right.
interested in this subject?
Well, I mean, the advice is a lot of seniors have already kind of had this mind thought of accepting the decline and
That's
accepting the
interesting.
fact that
Right.
we're older now. This is something that's, for young people. I could remember as a kid, as a young teenager, or around, I forgot what age, but I remember, there's these certain things that you remember of conversations or things that happen when you're young. And I remember one day being at my aunt's house. Um, and I don't know how the conversation started, but it started talking about sex. I mean, I was maybe 10 or 11 years old. And it wasn't a big conversation about sex, but there was some comment about, I think maybe uh, we were in her bedroom and she had a small double bed for her husband and her. My mother might have made some comment about, having sex or something like that. And I remember my aunt saying, "Oh," she goes, "No, sex is something for young people. I mean, that's, not, we're old. So we don't need to be concerned about that." And that stuck with me. I mean, all these years, that stuck with me. Well, that was the impression I got when I was young. I was taught that sex is for young people, but it's not. Sex is for everybody. Uh, I remember someone quoting, I think it was Carlos Santana, that in an interview he said there are three things people need. They need food, they need shelter, and they need sex. And when he says sex, and when I say sex, we're talking about what they need is that intimate connection. You can't get a better intimate connection with your partner. It's the highest and the most important intimate connection that you need to maintain. And there are ways of maintaining that, both emotionally, psychologically, and physiologically. So I would encourage really anyone, no matter where they are in terms of their marriage, their relationships, and everything, to keep that in mind, that this is something that needs work, as any relationship does. You need to basically do a little bit of work to maintain that, but the reward and the benefits that you'll get from that intimate connection is really the highest bonding and level of connection of love that a person can experience in life. And that's what we're all looking for.
Okay. It's kind of like you get a spark when you're young and you can't get the matches lit later. But what you've described are things you can light to make sex a good thing as you get older.
Exactly. It's
Okay.
not as easy to strike the match. You got to work a little harder to get it
Right.
aflame, but you can do it.
Yeah. Well, a lot of times you've been with the same partner for a long time. You know how to spark it. You just may
Mhm.
not get the flame lit.
Right.
All right. As I said, I'm going to give some information right after we finish, but I want to just thank you, Doc, for taking your time out of your busy retirement
All
to.
right. Well, it was a pleasure. I enjoyed talking to you.
I enjoyed speaking
And
with
I
you
look
also.
forward to following your podcasts.
All right, thank you very much. Let me just read a quick quote. I think I mentioned it to you. Um, you you covered Santana, isn't that correct? Just a moment ago.
Yes.
Okay. Well, I've got Nat King Cole for you.
All right.
He said, and I quote, "The greatest thing you ever learn is just to love and be loved in return." And with that,
Amen.
we'll just end this podcast and I'll just continue with the other information. Okay?
All
Again,
right.
doctor, thank you very much
Thank
for
you,
taking the
Ken.
time. Oh,
It
it's
was
my
a
pleasure,
pleasure.
my friend. Thank you very
Bye
much.
bye.
Bye bye. Again, I want to thank the doctor for taking his time, uh, taking up his time to help us understand the sex for seniors. And I wanted to take a few moments at the end of the podcast to give you some websites and organizations that you can speak to about sex and being a senior. Uh, Number one, you can try the National Institute on Aging, the NIA, and they have dedicated a whole section to the sexuality and intimacy in older adults. The American Geriatric Society, they have a website section on sexual health within its Aging and Health A to Z guide. Uh, the AARP is another excellent resource which offers advice and tips and resources related to sex and intimacy for older adults. And a website called Safer Sex for Seniors. The four is the number four, and this is a website that provides open discussions and resources on various topics related to sexuality for older adults. Uh, all this information will be on our website, and you can look at that. There's also relevant books you might want to get into. One is called Get It Up, Sex for Over 60. I'm not going to mention the authors. That'll all be on the website. Great Sex Starts at 50. The Elderly Gentleman's Creaky Sex Guide. I don't know what that one is. I didn't read any of that. Sexuality and Aging, Clinical Perspectives. Dementia, Sex, and Well-Being, a personal centered guide for people with dementia, their partners and caregivers and professionals. Um, then also Dr. Ruth, who just passed away, I believe, last year, uh, had an article or wrote a book, Revving Up Your Love Life in the Empty Nest and Beyond. And then the Sex Bible for people over 50, the complete guide to sexual intimacy in your prime. Uh, Again, if you missed any of this information and you would like it, you can go to the website, which is weareoldpodcast at .com, or you can send me an email directly at podcast, excuse me, at weareoldpodcast at gmail.com. And I thank you for listening, and I look forward to having you listen to one of our podcasts again. For today, thank you very much. Bye bye. And that concludes this episode of We Are Old, Get Over It. Thanks for joining me. I hope you found our conversation both insightful and entertaining. Remember, age is a journey, not a destination. So embrace the wrinkles, the forgetfulness, and the occasional tech frustrations with a good dose of get over it attitude. Until next time, keep laughing, keep learning, and keep getting over it. Ken out.